We'll start with just a bit of introduction on who I am. For those who don't know me, I'm Jen Woodhouse. I have worked at the clinic for 17 years. I've been an accredited exercise physiologist that whole time, and I'm now director at HFRC. In 2010, I did my Pilates training, and I did this through Stop Pilates, which at the time was the only internationally recognised Pilates training program. And I did it that way. If I wanted to travel, I had that in my little back pocket. And I've used it quite extensively with a lot of my clients at HFRC. So what I plan to cover in this talk is to give you the most information about what Pilates is and where it comes from. We're going to talk about how to get started and the basic principles that are used in everyday exercise, but also it's talked about extensively in Pilates. And then I'm going to finish the discussion with the current research and why Pilates is good for us to do and why we should incorporate it into our exercise regime. At the end of that, we'll have plenty of time for questions and talk about where to go from now with the new skills that you've learned. So we'll start with what is Pilates? And Pilates is a form of low impact exercise that aims to strengthen the muscles while improving postural alignment and flexibility. Pilates moves tend to target the core. Although it doesn't just only target the core, it also works to exercise the whole body. You can do Pilates with a mat, or you can do Pilates with equipment or without equipment. A lot of it's done on a mat, but we also have machines in the clinic, the reformers, which you may have seen. There is a lot of people doing Pilates. It's a very popular form of exercise. And in 2019, Pilates in Australia, the revenue was $730 million. So there is a lot of people doing Pilates. 1.3 million Australians are regular participants of Pilates. And you can see in the picture the different generations that are doing it. Interestingly, you know, these baby boomers make up a significant portion of them. 90% of people that do Pilates are women. And so there's no reason for that. I think that's been a marketing thing, and we need to get more men involved in Pilates. Okay, but where did Pilates come from? So the Pilates method of exercise stems from Joseph Herbert Pilates, who operated an exercise studio from the late 1920s to 1960s. He was born in Germany in 1880, and Pilates himself suffered from childhood rickets, asthma, and rheumatic fever. These early ailments saw him turn towards a life of improving his health and well-being through exercise and fitness. In World War I, he developed mat exercise and spring resistance programs to help the injured soldiers recover muscle tone more quickly. The exercise system that Joseph Pilates developed combined his personal philosophy of movement based on gymnastics, yoga, martial arts, and dance. One of the first principles of his methods includes the proper breathing techniques and posture. Controlology, as he called it, is the complete coordination of the body, mind, and spirit, and this remains the backbone of Pilates. He focused on building motions and activities that help strengthen the minor muscles while also building up the major muscles. As this method of stretching and strengthening was further developed, Pilates teachings were more defined into 6 main principles, and these include concentration, control, centering, the flowment of movement, the precision, and of course, breathing. There is a strong emphasis on stretching and maintaining a neutral spine during all these movements. It's about quality of movements rather than on the repetitions of exercise. So what is the core? The core is the girdle of muscles that surround the midsection of the body. In general, many adults just term this as abs interchangeably with the term core, but this is inaccurate. When we look at the anatomical perspective of abs, we often just refer to it as the rectus abdominis, the six-pack muscles. Now, these muscles functionally do not provide that much support for our spine. They do the flexing and extension of our spine and really make us look good down at the beach. It's the other muscles that support the core, that make up the core, that are actually more supportive for our spine. So these muscles include the diaphragm, our internal and external obliques for rotation, our transverse abdominis, which are our lower tummy muscles, our pelvic floor, and then those muscles that run along the back of our spine, the erector spinae, the multifidus, and the psoas muscles. Why is a strong core important? The core, or the midsection musculature, is the bridge between our upper torso and our legs. It is the source of stability during exercise and our daily activities. It protects our internal organs and stabilizes our spine. A weak core often leaves the body vulnerable to back pain and injuries. When it comes to Pilates, we've got these 5 basic principles that we keep talking about. These are a series of biomechanical body awareness issues that help provide the basis for a good exercise technique. Rather than being separate, the 5 principles, breathing, pelvic placement, ribcage placement, scapular movement, and our head and neck position, all work together to create intelligent ways of moving and in a safe and effective way. By learning these 5 basic principles at an early stage, it helps you become more aware of your body and how it moves and how it functions. And this will help with your skill level as you transition into more exercise in a mindfulness way. Okay, so when we're looking at these 5 basic principles, we keep talking about breathing. So that is the number 1 principle. Breathing encourages an effective oxygenation of blood. By incorporating proper breathing during exercise, it helps to relax the muscles and avoids unnecessary tension. A relaxed and full breath pattern focuses the mind and allows concentration on the exercise we're doing. By exhaling deeply, we can also help to activate those deep abdominal muscles. Breathing shallowly and into the upper portion of our rib cage tends to lead to an overuse of those accessory neck muscles, and it creates tension in the neck and the shoulders. But alternatively, by breathing low into the abdominal cavity, it relaxes the abdominal muscles and makes it harder to engage, and it leaves us unprotected when we're doing exercise. So by encouraging a proper breathing in through the diaphragm in a more lateral kind of movement, this allows us to expand the rib cage and activate the core muscles better. So right now we're going to get into a practical kind of moment. We're going to have a practice of that, training ourselves to laterally breathe. So if we can sit comfortably and we place our hands on the sides of our rib cage, I want you to take a nice deep breath into your nose and through your nose, and feel your sides expand. You want to feel the back of your body start to move. As you exhale, you want to exhale through your mouth. You'll feel your ribs contract as your hands will draw over your tummy muscles. So think of it like an accordion. You're expanding your rib cage with every inhale, and as you exhale, your tummy muscles are coming in and engaging. And that's what we want to think about with our breathing pattern in Pilates. When we look at pelvic position, there is 2 main pelvic positions that we will often refer back to. And this is a neutral spine and an imprint spine. So when our spine is in neutral, it is at its most stable. It acts as a shock absorber for most positions, and it's a good place to promote a good, efficient movement patterns. So again, to find our neutral pelvis, we need to find our ASIS, which is the bony parts of our hip. We're then going to try to create a diamond with our hands. We're going to place the heel of our palm onto the hip bones, and our fingers come down onto our pubic bone. They should form a nice triangle or diamond. When our hands are parallel, our pelvis should almost be like a table. It should be nice and flat. Here's where I often in a Pilates class talk about holding the glass of champagne. Today it's a martini glass. When our pelvis is in neutral, our dry martini should be perfectly balanced. If our pelvis is tilted forwards into an anterior pelvic tilt, our back will be slightly arched. This will cause our martini to spill. If we're in a more posterior pelvic tilt, our back is then flat into the bed, leaving our abdominals harder to contract. This will also spill the martini. So we want to find in our Pilates our neutral spine. The neutral alignment should not be achieved by forcibly arching our back. We want to do it in a nice controlled manner. You allow your weight of your sacrum to rest firmly on the mat, and this should allow our transverse abdominis, our lower tummy muscles, to engage. We shouldn't feel any strain through our spine when we're in neutral, and no tension in our lumbar spine. Imprint is another common pelvic position that we use. And that imprint spine refers to a slight posterior tilt. By using our abdominals, we can draw our lower back slightly towards the floor. When in supine, the pubic bone will be slightly higher. So when it comes to our exercises, as a general rule in Pilates, we have an imprinted spine when we do a series of abdominal exercises where our feet are elevated from the floor and are unsupported. So when our legs are in tabletop, we tend to be an imprinted spine. When our feet are fixed to the floor, then we tend to be in neutral spine. This just allows us a better ability to contract our oblique muscles in these positions. The third and often overlooked piece of our placement of our spine is our ribcage placement. A dysfunction in this area can contribute again to neck pain, shoulder pain, and thoracic spine pain. So we want to find the correct alignment for our ribcage when we're performing exercises. The rib cage and the thoracic spine, they combine to make a stable portion of our spine. It helps us to move our neck and our upper back more functionally. Stability of the rib cage and the thoracic spine is necessary to protect the vital organs and the chest cavity. But as in any part of the spine, it's stiff. So we want to try and keep it nice and mobile. What we want to have a look at in the 4 pictures below, the first 3, she's able to move her arms without moving her rib cage. This final picture, you'll see an overarching of her rib cage, and we call that almost like a popping sensation of her rib cage. If we don't keep our rib cage nice and stable, like in the previous pictures, we're more prone to increased tension in that upper back. Okay. The fourth part of our basic principle is getting our shoulders in the right position to perform exercise. I'm sure we've all experienced that overactive neck positioning, and that's all contributed to where our scapula sits. Again, if we haven't got our scapulas nice and stable, then it makes it more difficult to contract our abdominal muscles and to allow the core to work properly. If stability is absent, there's a tendency to overwork all those muscles around the shoulder joint. Now, the shoulder joint is a complex joint. The scapula is nice and mobile. And so it's got several different movements. So we've got to think about all those different movements to try and bring our shoulders back into a neutral position. So firstly, if we're, again, go back into our practical position, if we're reaching our hands out towards our computer screen and we reach our hands forward, you'll feel your shoulder blades separate. That's when we call our retracted shoulder blades. Okay, if we retract our shoulder blades and we're reaching too far forward and our scapula is not stabilized, you'll feel an increased tension through those chest and neck muscles. Alternatively, if our shoulder blades are too far back and too close together, you'll feel again an increase in the tension in the muscles of the back. So we want to find a midpoint between those two positions, and that creates a good shoulder and a nice stable shoulder position. So we want to be able to hold that shoulder position while we perform our upper body exercises or abdominal exercises. So when we're looking at shoulders, there's two types of neutral positions we're trying to find. We're trying to find that midpoint between retraction and protraction. We're also trying to find that midpoint between elevation and depression. A lot of us want to create too much neck tension and elevate those shoulders when doing exercises. We want to try and find a nice neutral position with that movement as well. If they're too far down, again, we're creating too much stress through the back of the neck. If they're too far up, it's the front of the neck that's having to work. So we need to find in Pilates, and when we do all exercise, a good neutral shoulder position. The final principle is trying to find the correct position in our necks. Again, we've got these overactive muscles in the neck that always want to try and help out. So we've got to try and find the correct position our neck needs to be in when we're doing our exercises. So when it comes to cervical flexion, we should begin with a slight head nod. Okay, we want to avoid jamming the chin into our chest. And I always say there should be enough room between our chin and our chest to fit a small fist. Or in a group class, I'll often say a peach. You don't want to squeeze all the peach juice out. You want to hang on to it without losing it. If we remember that, we generally get into a nice neck alignment. And then when we start moving, that position shouldn't change. So if we look at the third row of pictures, the model is trying to flex forward. This first picture, she's got her neck jammed right down, and you'll see that she'll have an increased strain through the back of the neck, those neck extensors. Alternatively, in the second picture along, she's lost that peach. So as her upper thoracic or upper back's trying to move, her neck's not moving in the same line and the same pattern. The third picture is the correct position where her neck and her back are moving at the same line, in the same motion. And so we have this correct alignment. Alternatively, when we flip over into a prone position, we have the similar story. As we're trying to arch and extend our upper back, the first picture, she's overextending her neck, which is creating increased tension through the front of the neck. The second picture along, she's not flexing her neck enough, so her back's moving, but her neck's staying still. Again, creating increased tension through the neck muscles and the shoulder blade. We want to keep that neck moving. In this final picture, you'll see her head, her upper back, and her neck are in one nice plane of movement. So we want to be able to do whole body exercises while keeping our spine in the nice neutral alignment. If we get those 5 principles and we think of those 5 principles when we're moving, our back is always supported and we're able to use our tummy muscles and our core more efficiently and more effectively. So now that we've got the 5 basic principles, what are the types of Pilates that we do? So Pilates refers to, there's 2 basic forms of Pilates. We have our mat-based Pilates, which is a series of exercises performed on the floor or on a table using gravity and our own body weight to provide the resistance. The main aim is to coordinate the deeper supporting muscles of the body to improve our posture and our balance and our coordination. The equipment-based Pilates includes specific types of equipment that works against spring-loaded resistance. So in the gym here at HFRC, we currently have a few reformers, and we're getting some nice brand new ones soon, so that we can do more classes using these spring-based carriages called the reformer. We also have a tendency to use other props, and these are specific Pilates-based weights that that provide extra resistance to the spine, to the muscles, and it makes our group classes and our sessions a little bit more interesting, a little bit more challenging, and variable. That's what I like about Pilates, is that no one class is the same. We can always modify it, we can always change it, we can always keep it interesting. And I think that's what will keep us exercising longer term. Okay. Now, we've talked about what Pilates is, but is it good for us? And what does the research tell us about why we should do Pilates? Okay. There's a growing number of us, particularly the physios and the EPs around, that are using Pilates as a form for their rehabilitation. So we like to have some good evidence-based research to tell us that we're doing we're doing the right thing. So I recently had a look through our journals and looked through PubMed, which is, again, the big database for all our scientific research. When I when I searched Pilates, we found that there was 677 published articles regarding Pilates as a form of exercise for chronic diseases. 570 of those have been published since 2010. So the research really is only just being started. Of these published studies, about a fifth of them are related to lower back pain and chronic back pain. There are some that look at a falls risk population, and is Pilates good for balance? Again, the next biggest one is Pilates good for cancer rehabilitation? And then it goes into some more of our cardiovascular disease, body composition, and then what we're most interested in at HFRC is the rehabilitation for hip and knee injuries. And there was a few, it's limited, but there were some studies on the benefits of Pilates as incorporated into your hip and knee rehabilitation. So we know chronic pain, lower back pain represents one of our major causes of disability worldwide. Interventions based on exercise have been more commonly used, and has been a commonly used treatment for lower back pain. And in the last few years, Pilates is definitely playing an increased role in the management of these patients. When we looked at the research of, again, why is it good for Pilates, and is Pilates good for this population? The earliest published article or systematic review, which looked at looked at 5 studies. They looked at patients with chronic lower back pain who had done Pilates, and they compared it to a group who did no exercise at all. And they found, as you would expect, that doing Pilates had a significant improvement in a patient's pain scores. These were obviously a lot lower. Their disability was a lot less than those that didn't do anything. Interestingly, at that time in 2010, they just compared Pilates to no exercise at all. So they haven't compared Pilates with other forms of exercise, which would be quite interesting to do, and is what they're tending to try and do a little bit more recently. So when we look at the 2013 paper that was published, they did look at that. They looked at a randomized control trial of those that did Pilates versus those who did gym-based exercises. And in this study, they found that the Pilates-based exercises were also effective in reducing a patient's pain and disability. But then there was, again, no superiority between the exercise, doing gym-based exercise versus Pilates. When we looked at older women who also had chronic back pain, who incorporated 6 weeks of Pilates into their routine in addition to their normal physical therapy, the 6 weeks of Pilates, they found that there was a significant improvement in pain scores, and that they also looked at these people after they stopped doing Pilates. They looked at them a year later and they found that their pain scores were still better. So by doing some Pilates, the results were able to linger for over a year. What else have we got? Okay. When it comes to falls prevention, we know that 1/3 of adults over the age of 65 will have a fall each year. The consequences are serious and are expensive. There's significant morbidity to having a hip fracture. And so we're always interested in ways that we can help prevent our patients from falling. So when we looked at what Pilates does for our balance and our falls, there was one big study performed in the United States. And they found that they looked at the Pilates on a reformer, and they incorporated Pilates once a week to patients over the age of 55. And by incorporating 1 week of Pilates to their normal routine, they were able to improve their balance significantly. They had an increased confidence from doing the Pilates, and they had increased functional mobility from doing that reformer class once a week. Those participants were doing a 1-hour group class, and they did that for 10 weeks to see those improvements. But these results were also similar in the previous studies as well. In the largest systematic review, which was published in 2020, they found that incorporating Pilates along with your other forms of exercise, you're able to improve your confidence and your balance, just like this initial study. When we look, is Pilates good for those patients recovering from cancer or who are going through cancer treatment? Most of the studies had focused, well, all of the studies had focused on women with breast cancer. And generally, this is because the reason why we see more breast cancer studies is obviously if you've got it doing a study, it's a little bit easier to get breast cancer patients because it's a more common form of exercise. So I think that's the reason why currently breast cancer is the main focus when it comes to Pilates as a form of rehabilitation. So in the initial 2017 study, what they did is they, with breast cancer survivors, they incorporated Pilates 3 times a week over an 8-week period. These breast cancer survivors reported a lower reported fatigue and depression scores than those who did no exercise at all. They also found that there was improved flexibility and cardio fitness with those patients. And they compared, I said that they did no exercise at all, and that was a lie, sorry. They compared those patients to home exercise routine, a group that just did home exercise routine. So they found going to a class regularly had improved ability of flexibility and cardiovascular fitness. When we looked at patients who had lymphedema, which is a common side effect post breast cancer treatment, this study in 2017, they got 100 women who had lymphedema and who were recovering from breast cancer treatment. And they found that those people who did Pilates once a week experienced greater improvements in their quality of life, a greater ability to move a greater range of movement of their upper limb, and they also experienced milder symptoms of lymphedema than those that did not do Pilates. So again, this was seen in 2018. Another study where they got in 2020, this trial, most recently the Move Mama study. They had a 3-armed study, and what they got is they got patients to do Pilates, they got another group to do dance, and another group just to follow an exercise booklet. And they found that those patients who did the Pilates and dance, the ones that the forms of physical activity required more thought and more thinking, that they had better results, and better results in confidence, better results in cardiovascular fitness, and a decrease in fatigue than those that just followed an exercise booklet. When we look at cardiovascular disease, this again is limited, this research. There was only 2 trials that I could find on the benefits of Pilates for those with cardiovascular disease. And I think this is because we know for cardiovascular disease, we know aerobic exercise has been proven to significantly improve cardiovascular fitness. In Pilates, you tend not to get your heart rate up as high as aerobic exercise. So we were not expecting Pilates to have a significant improvement in cardiovascular fitness. However, in these 2 studies, the 2012 study, they looked at 16 weeks of Pilates training, included with a normal cardiovascular rehab program. And they showed that if you incorporated Pilates as well as your normal cardiac rehab, the patients that had the 2 forms of exercise showed a significant increase in their exercise tolerance and their ability, and they were able to exercise longer than those that did not include the Pilates. They also had improved ventilation, and they also had an increase in their peak VO2 max, which is a significant, is a measure of our aerobic fitness. The study most recently published in 2020, it looked at women, 28 obese women who had high blood pressure. These patients were randomized to either a mat Pilates group or a non-exercising group. For 12 weeks, they found that 1 hour of Pilates on the mat compared to doing nothing at all significantly improved your blood pressure, your resting blood pressure. It also decreased your percentage of body fat. And this shows that for those people, it might be an option. So rather than putting them on medications, it may be an option to get them, it might be a way to introduce people into exercise. It's a less threatening form of exercise, but it's better than doing nothing. Oops, oh dear. Sorry. Okay. Alrighty. Sorry about that. Now I just have to remember how to split our screen. Okay. Almost did it with a whole hit without a hiccup. Technology is not my favorite thing. Let's skip through all of this. Okay, back on track. Okay, when we look at does Pilates change our body composition, which is, again, we know we have to exercise. to improve, to maintain our body mass. And we know that we need to keep exercising, so finding a comfortable way of exercising. So we wanted to look at whether Pilates could help achieve some of our body composition scores that we're trying to aim for. So this first study we looked at, there was 37 overweight, 2 obese women, and they were young. They were between the ages of 30 to 50. They were randomized into a Pilates group and then a control group. So in Pilates group, they had to exercise in Pilates for 90 minutes 3 times a week, and that was for 8 weeks. The controlled group, they were just walking. Okay, so when we compared the control group, when they compared the control group to the Pilates group, as you would expect, the Pilates group had significant changes in decreasing in weight, BMI, and fat percentage, and the waist, abdominal, and hip circumferences decreased after the training. So in this study, it suggests that Pilates 3 times a week may be more beneficial than walking for changes in body composition. In the 2020 study, when we look at an older population, so the 2020 study by Cruz looked at people over the age of 60 who lived in an retirement or a lifestyle village. They did a 12-week Pilates intervention, and they found that this was beneficial on improving our muscle strength in this population, our physical performance, and also our BMI decreased as a result. So again, this study highlights that it's beneficial for older populations as well as younger populations. It makes no difference as long as you're exercising. When we look at does Pilates make our legs stronger? Is it good for our rehabilitation? Again, there's a few studies that support the evidence of doing Pilates in building up our leg strength, in particular our quad and hamstring strength. So the first study showed that a 12-week exercise program is beneficial in improving our quad and hamstring function. When they looked at a population recovering from a knee replacement, they found incorporating Pilates early in a rehab program helped improve our postural control, but it also helped improve our quality of life for those patients recovering from a knee replacement. And similarly, we see the same sort of results with people with knee osteoarthritis. By doing regular Pilates, the study showed that the patients were able to decrease their pain while improving their function about the osteoarthritic joint. And we also see this in other chronic diseases. So one study showed that doing Pilates on a reformer was a safe and effective means of exercise with patients with Parkinson's disease, and also with patients with multiple sclerosis. They found that by doing mat Pilates and reformer Pilates, patients with multiple sclerosis were able to improve their balance and function. So again, it was another safe form of exercise for this population. So the research, although it's not extensive, it shows that it is a safe form of exercise. It should be used in adjunct with our other forms of exercise, but it's safe and it can easily be incorporated into our routines. With that said, HFRC is looking at incorporating more Pilates into patients' programs and encouraging more people to get exercising. So we've got new reformers that are coming in tomorrow, which is very exciting because I've been asking Brendan, Jay, and the other directors for reformers since I started here 17 years ago. So I finally won, and we've got 3 shiny new reformers that come tomorrow. And we're going to we'll start introducing people to the reformers with a free weekly, a free trial next week. So these sessions can be booked in online, or you can call in and speak to the reception. The idea is just to make people feel more comfortable with the reformers, and then if they like them, we're going to do some small, very small, because I only like 3 in a group kind of classes. And that's going to go with our group exercise timetable. If people aren't already aware, we also do some other group classes. So we do chair yoga. Physios have always done a bit of Pilates, and now we're just doing a more Pilates sort of fitness-based regime as well. So we've got some beginners classes and we've got some normal classes. But the great thing about Pilates is everything can be modified to suit a person's ability. So even if you go to what you might think is an advanced class, we can always make adjustments to suit your body. And that's what I like about Pilates, is everyone can exercise at the same time. So that's all I had to talk about. I think I went for a little bit longer than I was planning on, but I could talk about Pilates all day because I quite like it.